This is lab 25 on the cat specimen. So on the cat, things get a little smaller and are a little more difficult to see than on the dog. So some of the terms I may skip that are the really small print because either they're broken or not able to be seen on this cat, but I will do my best to show you what I can. So again, we're starting on the right half. If you have better nerves or arteries, whatever, on the other half, use that half, but we'll start on the right half and flip back and forth between the right and left. Okay, so we're starting with the facial nerve. So again, you're digging in this field deep to the ear, so deep to the base of the ear down here. So where the probe is would be the facial nerve. And so facial nerve is giving off these branches that we need to see. So you have a few of these little caudal auriculars coming off. And then we have the ventral buccal nerve here. So that's ventral buccal, and here we've cut apart the parotid salivary gland, but I kept the parotid salivary duct right here. So parotid duct is here, ventral buccal is here, and then we continue to follow and find the dorsal buccal nerve here. So dorsal buccal, and then our auriculopalpebral nerve is kind of coming off in two pieces here, but this would be auriculopalpebral where that comes off of the facial. And so you have rostral auricular branches going towards the ear, and then we have palpebral branches going up towards the eye. Then in the same field you may try and find your mandibular nerve, so it's going to be just in front of the ear and deep, and there are these little nerves kind of coming out here just in front of where that facial nerve comes out. So if you can find that, it's the auriculotemporal nerve that's a branch off the mandibular. And then our other parts of the mandibular, we're going to switch to the other head. And so here, you're looking in that deep dissection where we've removed the zygomatic arch, and you're looking right here for the mandibular nerve and its branches. So here again, the buccal nerve is broken. And actually our lingual is also broken. So it's right here. So lingual was that first most rostral branch coming off here. And so lingual goes to the tongue, and that's the lingual nerve. And then we have inferior alveolar nerve here, this nice big one, going into the mandibular foramen. And alongside it is that artery of the same name. So we'll get to that in a little bit. But inferior alveolar nerve, and then this little tiny guy right next to it is the mylohyoid nerve. So you may not see that one very well in the cat. But mylohyoid, inferior alveolar, lingual nerve. And then buccal was this other broken piece up here. All of those coming off of mandibular nerve. Then our maxillary nerve is the nice big one we see here. So maxillary nerve here, and then that's going to come out of the infraorbital foramen as the infraorbital nerve. So all of these pieces you see are all parts of the infraorbital nerve here. Okay. Then we have the medial side to do on. So here we're following vagosympathetic trunk, and you're cutting that longus capitis muscle and reflecting it caudally. And in the cat, it's a little bit harder sometimes to differentiate the two pieces, so just do your best. So the most cranial, most rostral aspect is going to be the cervical sympathetic trunk here, and then this little enlargement would be the cranial cervical ganglion. And then here you would have the vagus joining that. We do have a little cranial laryngeal nerve coming here, right there. And then our hypoglossal nerve will be this one kind of behind the other ones we were just looking at from this view. And then we'll follow that down, and you can see it from that ventral view, and it's the nice big one coming out here. So that's hypoglossal nerve. That should be it on the nerve section, and we'll move on to the cervical structures that you should know. And so here we have our thyroid gland, at least one lobe of our thyroid here. And we actually have an external parathyroid, this oval, lighter colored body right here. Okay, then here we have our esophagus, which we covered before and we've cut open. So esophagus has been split open. And we have the pharyngoesophageal limen right here, the differentiation between the pharynx and the esophagus. Then we have the trachea. So here, trachea, with those tracheal cartilages, the C-shaped cartilages there. And then if we flip it, we'll look for that medial retropharyngeal lymph node. So here, right there, kind of an oval lymph node right there. So medial retropharyngeal lymph node. And now we're going to move on to the common carotid artery. And so as you can see on the right side, it doesn't have injection. So I've done most of this on the other side of the head. Common carotid artery. And follow it along and see what we can find. Cranial thyroid would be here, and our other piece of thyroid is actually right here. So cranial thyroid artery there. And the cat doesn't really have an internal carotid. Instead, the carotid sinus is at the base of the occipital artery. So here is kind of where that carotid sinus is, in between the forceps and the probe. And so that would be at the base of the occipital artery, headed up that way. So then this is the external carotid here, this big piece that we're going to follow. And it looks like we might even have that little bit of the cranial laryngeal artery there. And then we have the lingual is the next one. So lingual artery right here coming up, going to the tongue. So lingual. Then we continue to follow this. I'll just kind of move things around here. And so the next piece we're looking for then is the facial. So facial is going to come off here. And then I've reflected muscles to try and see that branching. So here, facial coming through here. You have sublingual coming down this direction. So sublingual here, and facial will continue around the side here. So facial continues, sublingual artery. Okay, then we'll continue to follow our external carotid here. And you can just kind of move things out of the way as needed to do this. And so here we have that caudal auricular artery here. And then we have the superficial temporal. And this cat is pretty small, so it's right here, superficial temporal artery. And then this becomes maxillary. So then our maxillary artery we're looking at in this deep dissection field here. So maxillary is coming through, then maxillary here, and then inferior alveolar artery following along with that same nerve of the same name, going through the mandibular foramen there. And I do believe I broke my deep temporal, or caudal deep temporal. So it would have been right here going to the temporalis muscle. So then the rest of maxillary, unfortunately in this cat, lost its injection and was broken. So we have 2 strikes against us here. But we have this little bit, just right here would be maxillary coming along. Your external ophthalmic would come off with back here where it comes out again and go up towards the eye. So if you see something there, maxillary continues, and then it will come out of the infraorbital foramen. Again, it loses its injection, so we can't really see much of anything, but it's this little thing right here. So infraorbital artery at that point coming out with infraorbital nerve. And that should be it for Lab 25.